I'll explain a little bit about myself. I mean, you can see here in the first slide just a little bit of my background. So I'm the head of inclusive research and involvement for Choice Support, and I've worked with people with learning disabilities for over 12 years now. And the bulk of my work is around involvement and communication systems. So my team and we do lots of work around kind of getting people to be involved in everyday life, really, and also in all decisions they have to make about the service they receive. So in a sense, we do lots of work around empowering people and getting them to make to look at their support service and decide whether it's good enough, or they can go back and ask for more. And so a little bit around quality checking, which again I'm going to talk to you a little bit more today. So we do lots of other bits, of course, that they're not relevant now. So I'll start. Here it is, right? Okay. So I'll talk to you a little bit about the Association of Quality Checkers. So I'm going to start with saying a little bit about the association, and then I'm going to tell you a little bit. I'll give you more details about quality checking altogether and how we do it internally in Choice Support, and then I'll go back to the Association of Quality Checkers and tell you a little bit about the actual association, how it was formed, and what the aims, of course, of the association, and then how you can sign up, of course. So we want more people to join the association because it's a really good way of kind of promoting the work of quality checkers. So I'll explain everything towards the end. So just a quick summary of the association. So it is a non-for-profit membership association for organizations providing quality checking services. So this can be either support providers or maybe self-advocacy groups across the country, or whoever really has a team of quality checkers. So we were asking people to join in. So there is a membership fee, which again I'll explain a little bit at the end of the presentation. And this is purely just to pay for the kind of the general running of the association. So the website and kind of a little bit of administration that we need to have, of course, and that's it. So nobody's making any money. So the association is a campaigning organization, and the point of the organization is to promote the work of quality checkers and promote the members. So as a member, again, I'll go back to this later on at the end of the presentation. You get your own website, your own web page, sorry, into the association's web page, and then you almost get like a little pin on the map where you are and what type of work you do, and yes, how many quality checkers you have, etc., etc. So we launched the association in 2015. So it's in April. It's going to be 3 years. It's been a very slow process getting everything together, I must say, because, of course, I will explain again in a minute. It's a handful of organizations, and we've done that all on a voluntary basis. And it all kind of, took ages, of course, to sort out the website and the kind of, the constitution, if you want, of the organization. So let me tell you a little bit about quality checking to start with, and then I'll get back to the association in a minute. So, I keep pressing the button, and right. So quality checkers really are just people with experience of services that they check other people's service or other people's homes, if you want. So the whole idea of quality checking is that people that have experience of receiving a service, and this is almost like a peer support kind of foundation under quality checking. So because they have experience, we think, and we thought so over the last 10 or so years that I've worked for Choice Support, that is a good idea, and that people will associate much better with somebody with similar experiences than they will kind of, talk to other people like managers or myself. So I think the principle of quality checking in itself is really valid. Again, if you think about yourselves, that you know, when you discuss with somebody a situation or a personal matter, you would really want somebody who has a very similar experience would be able to associate a little bit better, understand you better, and maybe even advise you better. So that's kind of the principle underneath quality checking. Now, a few little details about choice support. So we are a social care charity, as I think many of you know already. And we started in 1984 in Southwark, which is a London borough. And then, so again, it was, as many other smaller organizations started then, with the closure of hospitals. People just left hospitals, and we created then this smaller organization, which it used to be called something else, not choice support anymore. And the idea was that people with learning disabilities will be supported to live in the community and to live safely in their own home, and that's what we always provided, in a sense. So now, over 30 years later, so we support again many people in much more many places in the country now. So we have services in Wakefield, in the Greater Manchester area, in Nottingham, in the home counties, so Bedfordshire, Buckinghamshire, and Milton Keynes, in several boroughs in London, and then down south a little bit, a few services in Portsmouth, etc. So although we became much bigger, we still think that we have the same values. We try to have the same values. So again, we are quality is at the center of everything we do, and hence we decided, as I said, 10 years ago, to develop the quality checking scheme, and I'll say a little bit more about that now. So really, the quality checking scheme is making sure that people have a good life, and this is almost like kind of, the bottom line of everything. So the quality checkers, our team of quality checkers and other quality checkers across the country, they just make sure that people receiving any support, they get a good quality support. Okay, so everything started in around 2018. Sorry, not 2018. 2018 is now. Everything started in around 2007. So it is over 10 years back than that the involvement team was established in choice support. So we did our first training as soon as we were in post in 2007. The first thing we did is establish a quality checkers team. So they were trained by Skills for People, and Skills for People, of course, is one of the founder organizations of the association, and they are almost like the inventors, if you want, of quality checking. So they are the first, as this small organization in Newcastle, you will know them. They are the first organization that established quality checking as an idea, and they devised the first ones to devise the training. And although they are still quite small, because it's a self-advocacy organization, they're not a support provider. They are the people that they have provided training in most of the quality checking teams across the country. So the Skills for People trained our first lot of quality checkers. We had originally around 8 people, I think, in our team. And you can see here some pictures from 2007 from the training. That's the bottom one. That's a training team it was a training team in Skills for People. And of course, the whole idea of quality checking was developed using the REACH standards. And the REACH standards, if you are not familiar, is a framework of quality checking standards that was developed by Paradigm. And it was Peter Kinsella then. It's Sally Warren now, of course. And so over the years, the REACH standards have been redeveloped, of course, and revisited. And again, I'm going to talk about the REACH standards in a little while. But the bottom line, the idea of the REACH standards is, again, exactly the same as we said about quality checking, is giving people a chance to evaluate and check their life, if you want, their housing, their support, and their personal relationships, their presence in the community, and identify if there is anything that they can do better. And in a sense, it's like a quality toolkit, and that's why Skills for People decided to use the REACH standards. There are another handful of different quality toolkits that people can use, or people use when they do quality checking. And again, I'll talk about this in a minute. So, as I said, we started training people in 2007. Over the years, I must say that now we have around 45 people employed in the organization as quality checkers. So our team has grown and has gone from strength to strength. So starting with these 8 people in 2007, we have grown quite a lot. So what do quality checkers do really is that they visit people in their homes, and they speak to people, and they find out from each person things about the support they get from their organization. But also they're looking at things that might be a little bit more personal to people. So about the housing, about their home, and about their personal life, their relationships, their friendships, and anything to do, their community presence, etc. So it's almost like a very kind of holistic approach. And in a sense, it can be summarized to these 2 things you can see here on the bottom of the screen. So people check if the other people, their peers, they have a good life, and if there is anything that they can do to get their life better. So in a sense, it's almost, when I do explain about quality checking, about the REACH standards, I always say it's a little bit like, it's January now, like when you do your New Year's resolutions. So you wake up on the 3rd, on the 4th of January, and after having kind of, partied and lots of food and drink over Christmas, you just make a plan for yourself, what you want to get better in the new year. So that's exactly what it is in a nutshell. So just to explain a little bit how it works internally. So we didn't want the quality checking team to fall kind of short of being important in the organization. So what we've done is that the quality checkers team sits under the quality department. So in the quality department, you have 2 lots of teams. Here you have the involvement team and the auditing team. So the auditing team is what we all do in all support provider organizations. So the auditing team, they go in and they check if people comply with the CQC requirements. And then what we do is that the quality checkers will follow in, and they will have another inspection, if you want, or another audit in the same service. But this time they will speak to the people who live in this place, and they will give a different point of view. So the audit team will go in and will check things like, your usual stuff, your supervision records, and all the paperwork, if it's everything in place for the manager, for the staff, etc., etc. They will, of course, look at the house, but it's a little bit more on the formal side, if you want, on the compliance side. So health and safety and all the things that everybody checks. Now, when the quality checkers go in, they will speak to people. They will actually sit properly around the table with people. They have a set of questions, which is based on REACH standards. I'll show you the REACH standards in a minute. And they just go through and ask people lots of questions. The quality checkers also observe a lot in their visits. So because, of course, they may be visiting services where people have more complex needs and they are not able to communicate. So we base our observations and our questionnaire both on kind of looking around what's going on in this place, in this home we're visiting, and also talking to staff. Staff is very important. Very, very often they carry over people's opinions, and they can tell you lots about the person they support. And they also, whatever they can pick up from the visit, during the visit, from the general kind of environment. Then what we do is that we pull these 2 reports together. So when the manager of the service gets a reply after the audit, they will get two reports. So one is from the auditing team and the other is from the quality checkers. And then they have to put together an action plan. And again, with this, I think over the year, it's fair to say that we learn that we have to follow up on the action plan. So everything that is observed from the quality checkers and the auditing team, of course, they have to write down some actions. They have to address any shortfalls they have, and they have to make sure that the people, because really what we write in the quality checking report is what the people told us or what the quality checkers have observed. I'll give you some more examples later on when you have some questions. Okay, so just to say as well that all our quality checkers, and of course this is something we picked up from Skills for People, they do a 3-day course, training course. There is a 4th day that is kind of an optional as a follow-up. So this training course, you can pick up lots of details if you want when you visit the service by observation, or you can read between the lines if you want, or just kind of by talking to staff and people in the services. So another thing that we do following the training, we try to develop the quality checkers all the time. So we have lots of sharing of experience kind of days. We have lots of team building days where all the quality checkers will get together. And also there is lots and lots of discussions around their work. So every time they visit the service and they come back, they have to write a report. So there will be a very open discussion area and place where people can bring all the things that they saw in the service and kind of, bring them up for a conversation, for a chat before they decide what they write in the report. Yeah, just going back to the training a little bit. So they also talk a lot about what experiences they may have from bad support. And again, I think this is the basis of the quality check in the foundation, that people have lots of their own experiences and they will use that to see if the services they use are good enough, or how they perceive a specific issue they encounter in a service, using their own experience, of course. So we can also say, we also discuss at the training, what can we tell from talking to people and meeting the staff is a little bit, as I said earlier, is a little bit like kind of by observation or reading between the lines. So when you see some kind of interactions between a supporter and the person in the house, what do you get out of that? What do we understand? And of course, lots of discussions around how people actually in the service, in the house, feel about their own life, if they have anything that they would like to improve, and in terms of their social life and their life inside the home or outside, their activities, their friendships and relationships, etc. So is again a very kind of holistic approach to quality checking. Okay, so again, over the training and throughout their working experience, the quality checkers have a lot of training and a lot of sharing of experience on how we listen to people they visit, and what we can read, or we can kind of assume, what assumptions we can make from the things they're telling us. We practice a lot how to ask questions. And again, this is another skill that people develop over time and with their working experience. So sometimes you have to drop something. So if the person doesn't want to share some information, you just drop it. You don't insist. Or sometimes you have to dig in a little bit more. So if you see that there is something there that you can investigate. So again, this is a skill that people developed over the years. And again, with observation, what to look at the person's home. Does it look like their own home? Lots and lots of discussions over the last 10 years about what it is, what it looks homely, what it doesn't look homely. And of course, these things are extremely interesting because they are very different for all the quality checkers and for all of us, yes. also checking who's in control of what goes on in the person's house. And I think we can all, the quality checkers definitely know how to check these things. So, yeah, the quality, all the work is confidential, of course. So we learn a lot, the quality checkers learn a lot about confidentiality. They learn a lot about safeguarding. So if there is an issue, and there are often issues that they can see straight away in the house, or something is reported straight to them, what do they do? Can they just keep it? Is it confidential? Can they break confidentiality? So again, this is a very big learning curve for the quality checkers to learn how to deal with these situations. They also learn to work as a team. So for an average kind of 3 to 4 people home, when they visit, it might be a team of 1 or 2 quality checkers. For bigger setups, it's going to be a bigger team. We also check day centers and community centers and bigger residential houses. So the teams are a little bit bigger then. So again, this is part of the training and kind of ongoing development of the quality checkers. They learn how to work as a team. They have to plan together how they're going to do the visit. So they have to inform the service. They have to get in touch. They have to send them some details and agree days and time. And then they have to plan the actual journey, how to get there. And of course, as I said earlier, when they get back from the quality check, they have to get together on a kind of almost like a third meeting and book 3 or 4 hours to sit around the table and bring all their feedback and write the report together. So these are very good skills, I think, for people working as quality checkers. So in the report, there are 2 sections. So we use a section with a tick, a green tick, which is what works well. I think it's very important. Again, the quality checking is all about celebrating good practice as well. So we don't go in with a critical eye to say, oh, actually, this is not. These are all the negative things. So there are 2 areas in the report. So what works well and what could be better. We have tried over the years to rephrase these things so they don't sound very critical or very kind of pointing the finger, really, because I think everybody can improve themselves or our work or everything, really. So it's almost making suggestions to people, to the manager, and bringing up the people's voice, the people who visited voices, really, and say, actually, this person discussed this issue with us, and we think that you can do this or that to make things a little bit better, in a sense. But as I said, at the same time, we do celebrate good practice, and there is lots of good stuff happening, not only in our services, everywhere. I think, and sometimes we don't say enough about these good things happening. So that's kind of the report. Just a quick look at the REACH standards. If you are not familiar, as I said, they were developed by Paradigm. Originally, it was a different pack when we started working with the quality checkers back in 2007. So this one has been redeveloped in 2012, and Paradigm asked us to help them redevelop that, because, as I said, we have very long experience and we've been using the REACH standards for a long time. So if you can see, there are 11 standards, and we just kind of, just a quick breakdown for you to see how they work. So standard 1, 2, and 3, they're talking about your house. So I choose who I live with, I choose where I live, and I have my own home. Then 4, 5, and 6, they are all about support. So I choose how I'm supported, I choose who supports me, and I get good support. And then 7, 8, 9, and 10, they're all around my personal life and my kind of social life, in a sense, my community presence. So it's about my friends and relationships. How do I keep healthy and safe, and what activities I do every day, and how do I kind of express myself as a citizen, what rights and responsibilities I have. And of course, number 11, that fits in with everything else, is what changes I want to make in my life. So in a sense, as I said earlier, it's interesting. that I see it almost like a New Year's resolution. So you can look at some areas that they need improvement, and some areas they're fine, and you carry on as you do, really, in your life. And when we visit service, when the quality checkers, it's not compulsory to go through everything. So people might be very happy where they live and who they live with, and they have maybe they don't own their own home, but they have a tenancy agreement and they have rights, and they know about the rights and paying the rent, etc. So maybe this area, it kind of examined very, very quickly, and then you look at something more specific that the person would like to discuss or make changes, as I said earlier. So based on these 11 standards, what we have developed since the very beginning is a very thorough questionnaire. So for each standard, you will have a set of questions. But as I said earlier, again, there is kind of lots of, we are very flexible. So if people don't want to answer questions about their friends and relationships, we don't have to ask them. If people don't have anything specific to discuss about their homes, we don't have to ask questions. But at the same time, if there is something that the quality checkers team find a little bit alarming, they will maybe try to dig in a little bit more on their questions. So again, it's a very flexible tool, and we play it by ear, and we try to collate as much information as we can about the home we visit beforehand. So we need to know how many people live there, definitely their communication skills, how people communicate, and also just get a little bit of a background information before we get in from the people who live there. So these are the current reach pack. I must say that in conversation with Sally Warren recently, I think they are yet again they are looking to redesign this and make it maybe a little bit more compact. But you can see on the left-hand side, you can see this is what we decided. It used to be called supported living, but I think people always, and I think many of you can kind of relate to that, people always thought a supported living as a model, and of course it's not model. So in 2012, when we helped Sally to redevelop that, we kind of, all of us, we agreed that we have to change the title. So it's called now Support for Living an Ordinary Life, because that's what it really is. It's just an ordinary life. Okay, so just again, kind of a little bit of a summary about quality checkers. So the checkers are experts at knowing if something is wrong when they talk to people, and of course, as I said, by observation. The quality checking finds many very good examples of support to share, and is what I said earlier for the report, that there is lots of good things, the green ticks, and we like to share good examples of good support. The report goes back to the people we visited, so is all accessible. It has lots of pictures. It's done in a way that people can understand what we say, and we explain a lot the different issues and what we saw and what we've heard from the people. So it's all accessible, and the main recipient of this report is the people in the place we visited, but also the report goes to the manager and the staff. And as I said earlier, we ask the manager, the requirement, at least internally in our organization, is that the manager will discuss that both with the people in the house, in their home, and the staff team, and then they will come up with an action plan, which they have to give us some deadlines on when they are action each item, of course. And of course, the report goes up back to the senior managers and the quality department, because it's part of the quality kind of process, as I explained earlier. So in a sense, the manager has to make a commitment to the people in the house and say, right, okay, we pointed out these shortfalls, and we're going to do something about that. Now, from kind of on one side of the quality checking, we have a team of people working as quality checkers. So, and this has been kind of, a massive development and an eye opener for all of us, I think. So is a proper job. People get a proper contract from us, and is a paid job. And this is actually, I'll tell you in a minute, is one of the requirements we have in the association, that all quality checkers are paid. So it is a responsible job, and people really enjoy. I'll give you some examples from the quality checkers in a minute of what they say. People really enjoy meeting other people. It's not a job for everybody. There are people that they don't feel that sociable, if you want, so they don't. They wouldn't like to do this job. So it's not for everybody. People also have to travel quite a lot. So we try. One of the things we try is we won't allocate a quality checker to do a check in a service where they know the people, just to keep kind of conflicts of interest out of the way. So quality checkers in London will travel maybe in Milton Keynes or somewhere nearby, or quality checkers from one London borough, they're traveling in another London borough to check other services. So we just try to keep this kind of, in a very open and clear way. It is not a regular job, as I said, but people are getting paid, and they have an ID badge, and they have a contract, a proper contract with choice support. So we are all work colleagues in a sense. So here's some kind of examples from quality checking. So what does a quality check tell us? So recently on a quality check, we were visiting someone at their home, and they were telling us about lack of privacy. At one stage, a member of staff walked into the lounge where we're talking privately with a person, and she just came and sat on the coffee table. We kindly asked her to leave. So you can see it's interesting how by experience, of course, the quality checkers know very well that if somebody in a house we visit, they ask for private time, they just have to have private time. So if they don't want their supporters to be around when they speak to the quality checkers, we just ask them to leave. So kind of this is a good example of how much people have learned and grown into their job and into doing this job over the years. And another example here, in one service, staff said all service users had to be in bed by 8:30 because the sleeping staff came on duty and the afternoon staff went home. The staff rota is now written around the needs and wishes of the people receiving the service. So again, this is something that it was at least quite common in many services. You have a shift finishing at any time of the evening, and then everything just stops there. So people have to come back home if they are out and enjoying themselves. No, you have to go back home at 8 o'clock because at 8:30 is handover time. So these little things that the quality checkers listen and observe, they make a big difference around people's support, in a sense, and in their life. So yeah, and just to say, of course, again, very important. I think over the years, it's fair to say that quality checking has been almost like proved itself to be a very valuable tool, and also giving people with experience of service a chance to utilize their own experience. So of course, you will know that the Care Quality Commission has we've been managing their experts by experience contract for the last 5-6 years. So they almost picked up the same values and the same idea of quality checking, which they call experts by experience. So what's happening now in our contract to CQC, we manage over 500 experts by experience that they will go in with an inspector in every inspection, in every CQC inspection, and they will bring a different point of view alongside the inspector. So I think this is almost kind of proves the point that quality checking is a really interesting kind of scheme, and the principles and the values that underpin, I think, the whole scheme of quality checking are very valid. They are recognized now, but the regulator of health and quality and health and social care in England, and also, of course, we have done lots of work, and some of the organizations in the association, they are from Scotland and Wales and Northern Ireland. So even if these other regions they have different regulators, they are still kind of on board with these principles and values. So I think this is a very important piece of work. And of course, you will know, maybe some of you, that from other schemes that there is lots of local authorities that they commission through their kind of the self-advocacy groups, their own quality checking services. So, for example, another interesting thing is that in 2014, and for 3 years, we won an innovation fund from the London Borough of Southwark to train and establish a quality checking service for 30 quality checkers. So this was on top of our internal quality checkers, and the scheme ran out last June in 2017, but the quality checkers still working, doing the same work in the borough as the quality checkers in choice support that we use internally. Okay, so again, I think I have repeated that. So there are people, quality checkers are people who are paid to check health and social care services. And this is both from CQC and internally. They have a disability or mental health needs, or they're a family carer. So they have, I think CQC, and we are as well, we're trying to make sure that the person who does the audit, the quality check, is matched on the same experience, if you want. So, I mean, we are a little bit more flexible because we have our services are limited mostly to people with learning disabilities and some people with mental health. But in CQC, we know that if they are visiting a service for people that they're blind, then we get somebody who has exactly the same experience, so they are blind as well. Or if they're visiting, if they are inspecting services for carers, they will have people with that they are carers on board, or if there are services with mental health, they will have people that they have mental ill health on board to help the inspector. So they have experience of using services themselves, and they know, they of course, they know, they do lots of work with the inspector beforehand and after. They know what questions to ask and where to find the answers, what to observe and what to look around during the inspection. So just to go back to the Association of Quality Checkers, and I'll explain a little bit more about the process, of course, is that, so the aim of the association is to raise the profile of quality checking in health and social care services. So the initiative of the association is that to give smaller organizations a chance to pick up work in their local area, if you want. So instead of bigger organizations like ourselves, like Choice Support, being everywhere on the websites, on Google, if you want, and being the most prominent ones, what we want to do with the association is, as I said earlier, put pins on the map and say, here, look, you know, if you want somebody to check your services, there is a small self-advocacy group in your area, so give some work to them to do. Or if you want some training to establish your own team, instead of calling a big organization like Choice Support, why don't you call your local self-advocacy group and call them to come and do the training? We also aim to showcase best practice, themes and trends in health and social care. So again, is lots of kind of publicizing the work of quality checking, getting people to understand what it's all about, and maybe even kind of, you know, buying into this, your services. And we also campaign for employment rights and citizenship for people with disabilities. As I said earlier, for an organization to join, I'll talk you through about that in a minute. To join the association, they will have to give people contracts and to pay people like, you know, a rate, an hourly rate to do this work. So we don't think it's acceptable anymore that people get paid in vouchers, or they don't get paid at all to do this job. So our feeling in Choice Support is that if I get paid to coordinate the quality checking, then the quality checker should be paid as well. So so these are the 5 requirements we say that we ask organizations to fit in, to have in place before they join. So they have to pay all quality checkers. they have to offer induction and ongoing training and development to the quality checkers. I said earlier, our training, this 3 to 4 days training, is really important. People learn a lot during the training, but you have to offer quality checkers ongoing development and training so they can develop their working experience and they can share with other quality checkers. The organization has to offer support to quality checkers. So if people need somebody to use a computer, or if people cannot read. So again, with our quality checkers, there is always a coordinator that will go in with them and make sure that the quality checkers are on the forefront, if you want, of the visit, of doing the quality check. But there is somewhere somebody to help and support them if they need something specific. The quality checkers are using a kind of a type of a tool that promotes citizenship and community life. Now, I have mentioned that we use a REACH standards. There is another couple of toolkits that they're available on our website, and you can go and check them. They're all free to share around, really. And also that the organization has appropriate policy and procedures, which most organizations have anyway. So these are the 5 requirements for an organization with quality checking services to join the association. In a sense, we have an associate membership as well, and that means that if an organization, they try to get a team of quality checkers trained to start working for them, and they haven't done this yet, they can become an associate member of the association, and we can help them. We almost kind of give them like a little bit of a deadline, if you want, for 6 months or a year, and we can help them with training and establishing, if you want, the systems behind. So how do they pay people? How do they do contracts? How do they do recruitment, etc., to get the team on board? So we give them like a year's time to be helped by one of us to establish the team, and then they can join in. But I think that it's important to say that the end result of the associate membership is that people will fit in with these 5 requirements at the end. So again, there is no excuse of not having any of this in place. So here is some details of the website. So you can see here a picture of the homepage when you start, and this is the web page, thequalitycheckers.org.uk, and we have a Facebook page as well. So this is it's called again Association of Quality Checkers. So you can find lots of details there in the website. So how to join us, a little bit of history, and the tools, as I said, the quality tools that we are using, they are all there. There is also stories and news, and we are hoping very soon that we're going to have, over the last year or so, we've been a little bit kind of inactive, if you want, because it's kind of almost getting a little bit of money into to sort out the administration. But we're hoping very soon that we're going to publish our first newsletter. So stories from different members are going to be published on the newsletter, and we try a little bit kind of to promote this work and shout out. We also, all the founder organizations, again, you can see them on the tab that says they're about us. We do lots of promoting of the quality checkers across the country. So if there is any conferences or any presentations we can do, like today, LD very kindly is hosting us. We try to promote a lot the work of the quality checkers. There is lots of people on board, of course, lots of organizations. But as I said, CQC they have embraced the kind of the principles and the values by establishing their own experts by experience. NHS England is on board as well. We have been working together with NHS England the last year or so to develop the health quality checking scheme for them. And again, that's a big piece of work for the association. And hopefully there are going to be many more teams across the country that they will start doing this work, and they will be kind of, backed up by NHS England. So I think that's me. Thank you very much for listening.